Okay, next we are going to talk about your hip, okay, or the pelvic area of your body. Now, as you can see, there's a little bit going on here. These individual bones right here are what are called your os coxae, or your coxal bones. Okay, there are three separate bones that are located within here that are fused anteriorly by what's called the pubic symphysis, and that are fused on the posterior aspect at the sacrum. Okay, and all of these structures put together, fused to form this one giant structure, is called the pelvis. Okay, and then, as you know, within the pelvis, this is where the reproductive organs are housed and protected. Okay, and then if we were to remove the sacrum and remove the pubic symphysis and just look at an individual coxal bone, then that would be called the pelvic girdle, the point of attachment for your lower limbs or your legs, or specifically your thigh. Okay. Now let's look at the three different bones that make up your pelvic girdle, or an individual os coxae or coxal bone. The largest portion is what's called the ilium. Okay. Now the ilium has a very distinct crest. Okay, and this is a very important landmark. You know, in case when you're palpating someone, you know, if you need to put if you cannot put a leg limb on somebody when you're placing an EKG, you would place it just above the iliac crest. You know, this is where they do bone marrow biopsies. This is where we, you know, around this area is where we do skin fold tests. Okay, so there's a lot of, so it's pretty important to know where the iliac crest is found. Okay, and then on the anterior portion of the iliac crest, there are two distinct landmarks. What's called the anterior superior iliac spine, and the anterior inferior iliac spine, or the ASIS or AIIS, often abbreviated. Okay? And then imagine that there are some rough, tough ridges on the lateral aspects of the ilium. Those would be called gluteal lines. Okay, and these are areas where the three gluteal muscles, the maximus, medius, and minimus, originate at. Okay? And then let's go to the anterior portion, and then you can see the pubic bones. Okay? So here, this is called the obturator foramen, this opening in the pubic bone right here. Okay, and then in men, this is where the spermatic cord would travel up through and into the pelvic area. Okay, so the vas deferens from the testes travels up through here, and then back to the posterior portion of the urinary bladder, and what are called, where sperm is then stored in what are called secretory vesicles. Okay, and then plus the testicular arteries and veins and nerves and all that stuff travels down through here in one big cord called the spermatic cord. Okay, and then on the pubis, okay, we have the ramus of the pubis, or this lower curvature down here. Okay, and if we flip over to the ischium, which is on kind of the inferior posterior side of the coxae or coxal bones, you have the ischiotuberosity. This is what you guys sit on when you're sitting on your butts. Okay, and then you'll notice in these three areas where these bones come together, they form a socket called the acetabulum. Okay, the acetabulum is the point of attachment for the head of the femur of your thigh. Okay. So as you can see here, acetabulum, head of the femur. So now you have a ball and socket joint, just like your shoulder. Okay, and then you can create movement down at the thigh. Okay.